something we were doing was utterly wrong. And the CDC says that's because we're the sickest people in the world. I'm not going to come in here and impose my belief over any of yours. Instead, we're going to work together to launch a new era of radical transparency. So we will convene representatives of all viewpoints to study the causes for the drastic rise in chronic disease. Some of the possible factors we will investigate were formerly taboo or insufficiently scrutinized. A childhood vaccine schedule. Whatever belief or suspicion I have expressed in the past, I'm willing to subject them all to the scrutiny of unbiased science. That is going to be our template, unbiased science. That's something that will make us all proud of this agency and of our role in restoring American health. I'm very, very happy to be here today. I'm proud that President Trump has appointed me to the position of trust to carry out his agenda to make America healthy again. This is the mission that President Trump and I hold in common, and that has inspired a tectonic outpouring of enthusiasm and support from the American people. It's not difficult to understand why. In the U.S., 6 out of every 10 adults have at least one chronic disease, and 4 in 10 have 2 or more. The U.S. has the highest age-standardized cancer incident rate among 204 countries in the world, nearly double the next highest rate. Asthma and autoimmune diseases are far more common in the U.S. than in any other part of the world. Prior to COVID, American life expectancy averaged 7.8 years. That's about 4 years shorter than comparable countries. Autism now affects 1 in every 36 kids, a more than 4-fold increase over past decades. 18% of teens suffer from fatty liver disease. Nearly 38% are diabetic or pre-diabetic, and more than 40% are overweight or obese. These conditions were virtually unheard of when my uncle was president, 1960 to 1963, when I was a 10-year-old boy. The sperm counts and testosterone are down about 50% in American boys, and our girls are reaching puberty 6 years earlier than historical generations. Our only solution to these issues seems to be more and more pharmaceutical interventions that don't seem to be alleviating the problem, and in many cases appear to be worsening it. Over-medication, particularly in children, is a growing issue. More than 3.4 million American children are currently taking medication for ADD and ADHD, and yet the numbers continue to rise. President Trump has asked me to reverse the epidemic of chronic disease. The way to do that is to bring HHS to its full potential as the steward of the American healthcare system. America was at the apex of its power and prestige, and all the world looked to us for leadership. This was particularly true of NIH and CDC and FDA. They provided the gold standard of science and research, trusted the world over. Countries that didn't have their own research institution, for example, the new countries of post-colonial Africa, trusted American science so much, and many of them wrote into their own laws, if the FDA approved it, then it's approved in our country as well. I want the agencies under HHS to earn that level of global trust. And what is the path to public trust? The path to trust is always through transparency. Transparency is the foundation of science, and it is the foundation of democracy. No one trusts science that isn't transparent about its research hypothesis, its raw data, or its conflicts of interest. No one trusts a government built on lies, on secrets, on cover-ups, and propaganda. That's why my uncle famously observed that the word secrecy is repugnant to a free and open society. Healthcare policy has been the subject of intense controversy for 20 years. But have you noticed that the controversy is almost entirely about who pays for it? Republicans and Democrats fight these ferocious battles on Capitol Hill, and it's always about who to shift the burden of paying for it. And for me, I've said before, this is like moving deck chairs around on the Titanic. Our health is getting worse and worse. And when the total costs are over $4 trillion as they are now, there is no good solution, only less bad ones. We need to start asking a very different question. Regardless of who pays, why are we paying so much? Well, which is, by the way, 2 to 3 times what European nations pay for better, for worse health outcomes. Well, corruption and efficiency may be part of it. But the main reason is quite simply that Americans are very, very sick. We are, in fact, the sickest nation on earth with the highest chronic disease burden in the world or in the history of the world. During COVID, we had in this country 16% of the global COVID deaths. We only have 4.2% of the world's population. So something we were doing was utterly wrong. And the CDC says that's because we're the sickest people in the world. They say that the average American who died from COVID had 3.8 chronic diseases. So were they dying from COVID or were they dying from chronic disease? According to some estimates, 90% of healthcare spending today goes toward managing chronic disease. When my uncle was president, it was 0. We didn't even have drugs for chronic disease then. And now it's become a burden that's threatening to sink our country. So my main mission at HHS, in which I hope that you will all join me, is to reverse the chronic disease epidemic in America. How are we going to do that? It isn't by replacing one paradigm with another one by force. I'm not going to come in here and impose my belief over any of yours. Instead, we're going to work together to launch a new era of radical transparency. Only through radical transparency can we provide Americans with genuine informed consent, which is the bedrock and the foundation stone of democracy. Transparency allows diverse parties to establish common ground of mutually trusted information. That's a basic precept of science. Results have to be reproducible. The whole experiment has to be open to scrutiny and replication. It's no secret that many of our institutions of democracy, our democracy, of course, but even of science and medicine, are no longer transparent. As a consequence, they have become inefficient, dysfunctional, or corrupt. They have fallen captive to the profit-making industries. They have stagnated in bureaucratic secrecy and in siloing. They have lost touch with ordinary citizens. But here's the paradox that a lot of crusaders need to understand. Most of the people who work in these institutions and agencies and organizations are competent, ethical, and caring, and idealistic. I think that's especially true at HHS. Another reason why our agencies have lost public trust is that they become too politicized. Well, our health should not be a political issue. As I said to President Trump the other day, there's no such thing as Democratic children or Republican children. These are all of our children, and all of us want to keep them healthy. It should be an issue of science and an issue of basic human compassion. Science gets politicized when power and profit are involved, and power and profit are blind to compassion. Reducing the influence of money, therefore, goes hand in hand with depoliticizing HHS. I've spoken of science, and now let me speak about compassion. HHS is the home to programs like Medicare and Medicaid, and between them serve over 160 million Americans. The same Doge technology that has uncovered vast amounts of waste and fraud can be used to better serve our fellow citizens who depend on these programs to make sure that no one is left behind and no one is left out. We will aim to set a standard of courtesy, efficiency, professionalism, and integrity that will make HHS again the envy of the world. Let me say one more thing about politicization, and this is personal. As you know, I've come through a very highly polarized confirmation process. The fog of narrative warfare has made it hard to get a sense of who I am and what I believe and what I represent. A lot of times when I read these articles characterizing me, I think to myself, I wouldn't want to work for that guy either. So, since we all are here together, I have a request to make from you, my new colleagues. Let's start a relationship by letting go of any preconceptions that you may have about me, and let's start from square one. Let's establish a mutual intention to work toward what we all care about, the health of the American people. Last Thursday, President Trump signed an executive order to establish the MAHA Commission to study what has caused the precipitous decline in American health over the past 2 generations. So we will convene representatives of all viewpoints to study the causes for the drastic rise in chronic disease. Some of the possible factors we will investigate were formerly taboo or insufficiently scrutinized. The childhood vaccine schedule, electromagnetic radiation, glyphosate, other pesticides, ultra-processed foods, artificial food additives, SSRI and other psychiatric drugs, PFAs, PFOAs, microplastics. Nothing is going to be off limits. Whatever belief or suspicion I have expressed in the past, I'm willing to subject them all to the scrutiny of unbiased science. That is going to be our template, unbiased science. That's something that will make us all proud of this agency and of our role in restoring American health. Let's commission research that will satisfy all the stakeholders once and for all. Let's use protocols that we all agree on in advance and not alter the outcomes of studies when they're halfway through and that they look inconvenient. Let's all depoliticize these issues and reestablish a common ground for action and renew the search for existential truth with no political impediments and no preconceptions. Finally, I want to ask you to think about an even larger challenge to this agency. If we're really going to end the chronic disease epidemic, we need to recognize the connection between the physical decrepitude that now beleaguers our citizenry and the pervasive spiritual malaise that has left so many young people feeling alienated, dispossessed, disconnected, purposeless, and hopeless. Spiritual and physical maladies thrive on one another. They feed on one another. Our overall wellness must begin with a spiritual question. How do we relate to ourselves, to each other, to our communities, and to the planet? Vested interests in malignant political actors profit and flourish when we are atomized and fragmented, and uncertain when we can be easily propagandized, when we live in fear and helplessness and victimization. These forces prefer to have us in terror and anxiety, which disable our capacity for critical thinking and make us more compliant and more credulous. They want us hiding from ourselves to avoid our own shadows and dulling our pain and loneliness through sedation and distraction. Yet inside of us, we know that love and self-knowledge are the only true paths to good health.